Good morning, good afternoon, and good evening, everyone, wherever you may be joining us from in the world today. My name is Francesco Del Carpio. I am the CIFAL York Operations Coordinator, and I would like to officially open the first session of the Climate Change and Global Occupational Health and Safety Speaker Series, which is being presented in partnership with the Restore Lab at the University of Toronto, the Data Lay Institute for Global Health Research, and the Global Labor Research Center. I would like to start the session with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have long-standing relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Takaranto and has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation, and the territory which is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event and our participants may be joining from various locations, I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderator, our speaker, and our participants from around the world. Welcome to our webinar. And for those of you who may not be familiar with CIFAL York, our center was established in 2020 and started its operations in 2021. CIFAL York was created in collaboration between the United Nations Institute for Training and Research, UNITAR, and York University with York Region to develop and deliver training and knowledge sharing, as well as capacity building programs across 5 focus areas, which are disaster risk, emergency management and humanitarian actions, health development, environment and climate change, entrepreneurship, digital technology and economic development, equity, diversity and inclusion, and advancing the UN's Sustainable Development Goals. Without further ado, it is my great pleasure to introduce our moderator, Dr. Eric Kennedy. Dr. Kennedy's research focuses on knowledge production and mobilization in emergency management contexts. His work has explored the use of models, technical advice in forest fire management, as well as disaster research methods and data collection practices in COVID and natural disaster contexts. His current research explores the structure and institutional design of knowledge synthesis mechanisms in emergency advisory contexts, as well as sector planning mechanisms that influence research funding and practice in the wildfire context. Dr. Kennedy also works on these issues in practical ways, such as serving in emergency advisory roles like the Ontario Public Health Emergency Science Advisory Committee. Dr. Kennedy, thank you very much for moderating this session, and the floor is yours.
Thanks to everyone for being here today. We're thrilled to have you in attendance, whether you're watching live or joining us in a recorded session later on. We're also thrilled to have you join this very first of the sessions in the Climate Change and Global Occupational Health and Safety online speaker series, and encourage you to consider attending all of the 6 sessions that we have planned. There's also an opportunity to earn a certificate of attendance if you're able to come out to several of these. And so I'd encourage you to check out our website and learn more about the series as a whole. I'm delighted to be your moderator for today, and will help to try to keep this conversation moving and ensure that we all have a chance to ask whatever questions we're interested in. To that end, you should have a Q&A button down below, which will allow you to pose questions to us as organizers and moderators, as well as to our wonderful guest speaker. I'd encourage you to use that regularly, often, and frequently throughout the presentation. We can share links in there as well, or if you want to ask follow-up questions, that's great. You can also bring up issues for discussion or questions you'd like answers on during our Q&A towards the end. So please do write in your questions there. As we get to the end of the talk, I'll try to synthesize them together and bring them into our conversation. With that out of the way, it's my absolute pleasure to welcome Dr. Behdin Nowrouzi-Kia. He's an assistant professor in the Department of Occupational Therapy and Occupational Science at the University of Toronto, where he also holds the inaugural Emily Gelbsaler Grant Early Career Professorship in Workplace Mental Health. Through an occupational lens, his research program is a systematic study of occupations in the areas of work disability prevention, return to work, and disability management. This approach is designed to produce results directly applicable to identify and to assess risk and to develop interventions for preventing and improving high-risk behaviors in the workplace. His work is motivated by efforts in the field of disability prevention that extend beyond the efforts to prevent or cure diseases from a purely physical perspective, and instead look towards more holistic approaches. The major tenets of his work uses a biopsychosocial perspective to understand work disability and extend towards incorporating personal characteristics and environmental systems and workplace compensation factors into improving health outcomes. We're so delighted to have you with us today, and we're grateful for your time in preparing this talk and the wisdom that you're going to share with us. And so I'll pass you the floor now, and we look forward to your presentation. Again, please do feel free to share your questions below so that we have a chance to incorporate those into the discussion following this talk.
Okay, great. Thank you very much for the wonderful introduction. Thank you very much for the warm welcome. Delighted to be here with you today and to talk about the idea and the topic of climate change and occupational health. This is something that I've been pondering about for quite some time, and I think our lab at the University of Toronto is actively studying, and we'd like to share kind of some of our perspectives. I come into this, I'll tell you a little bit about myself. I trained as a healthcare practitioner first, so I'm an occupational therapist, and I'll tell you a little bit about what that is. Many people aren't sure what an occupational therapist is. Maybe they think it's a physical therapist, but I'll tell you a little bit about that. And hopefully by the end of the talk, I've had an opportunity to further convince you about the importance of understanding climate change, not only on human health, but in particular on the impacts that it has on work. And hopefully by then, you're also going to be further convinced that work and health are integral parts of our identity, our wellness, or our well-being, and are intimately connected to how we engage with one another and our surroundings as well. So I'm just going to proceed ahead. So this is a little bit of disclosure about me. I won't spend too much time on it, but these are the grants I hold, the speaking honorariums that I receive, consulting fees, and also different titles that I have as well. I have no conflicts to declare here today. And also what I'll be presenting to you is evidence-based. So it's going to be grounded in empirical research and peer-reviewed research. So I'm quite confident that what I'll be speaking about will have a substantial amount of body of literature to support it. So let's get started. So I have three learning objectives to kind of go over, and one is to just introduce the topic of occupational health and safety and look at its relationship to climate change. What impacts are we seeing as a result of climate change? And further along that line, to kind of see the underlying themes or threads and see how that is impacting work and health. And finally, to recognize its importance and develop further steps and strategies that can support all of our activities and all of our initiatives in this area. So before I kind of get started, I want to talk a little bit about work and health. And you may already know this, maybe this is something that you are not as familiar with, but there is a substantial amount of literature from different disciplines, including mine and others such as occupational medicine, occupational health, public health, that look at the relationship between work and health. And what consistently has been demonstrated for now many, many decades is that there is a positive relationship between work and health. Working or engaging in meaningful activities that are paid are good for your health. That's part of the tenets of occupational therapy, where we essentially look at providing interventions or treatment approaches that engage people in activities or what we call occupations that are meaningful to them. So at work, you'd want to, for example, identify ways that somebody may promote their health and well-being. Of course, that is not only just a positive aspect. Too much work can be deleterious for your health as well. It could have negative implications. I'll talk a little bit about what that means, but this is a careful balance, and that careful balance has to be respected in that occupation has quite a bit of power, and it's intimately related to our physical health, our mental health, our well-being, but of course, too much of it can also have negative outcomes. Another way of looking at this is that an individual will benefit from working, but that benefit and the things that come along with that oftentimes are related to their control over the environment that they're in, whether or not the tasks that they're doing are meaningful, and so forth. And there's again a multitude of research that's well beyond what I can present to you in my talk today that discusses this. But at the what I wanted to highlight is just that there is this positive relationship with work, and that we have to be mindful of the fact that that positive relationship can also lead to too much work, or on the obverse side of it, not enough work. And in my clinical discipline and in occupational science, we kind of have terms for those. We call them occupational deprivation, when you don't have enough of that engagement with the activities that you're doing. And if we looked at work activities, that could be intimately tied to your identity, your well-being. In fact, if you reflect on some of the initial questions you ask anybody, maybe what is your name, and then what do you do? So you can see how this is so closely tied to what we do as human beings. And the other factor to consider is that as adults, which adulthood occupies for most of us the majority of our lifespan, we spend working. So we have to be able to carefully understand this relationship between work and health, and also, as I will get into later, understand how it's being influenced, for better or for worse, by what's happening on as a result of climate change. In terms of background, obviously there is substantial bodies of literature that looks at unemployment. So I'm using the term unemployment to be more accessible to a broader audience, but in my field, we'll call that occupational deprivation, or that lack of meaningful engagement, and it leads to all of these health outcomes, which are quite significant. And if I put my clinical hat on for a minute, and for the clinicians in the room, you recognize that oftentimes we want to support our clients or our patients to go back to work in a timely manner, because we know that being off work for a substantial amount of time will actually lead to people not going back to work. So the fact that we can engage them in work can lead to proper and appropriate outcomes, but their lack of engagement will lead to what I have here on the screen. So now that we know a little bit about the benefits of work, the relationship to our health, and perhaps how it's integral to our well-being, we have to talk a little bit about climate change. It goes without saying that the Earth climate is being influenced by anthropometric, human-made, and ultra-natural factors altogether. And those influences are shaping the world we live in a myriad of ways. And they have consequences. They have consequences for the physical environment, the environment that you and I interact with. And we don't need to go any further than thinking of that once in a generational pandemic that we've just experienced and continue to experience. I'd be on the camp that thinks this pandemic is still ongoing as a result of, and some people may argue, climate change, maybe not, but there is evidence to substantiate that this is influencing how we as human beings are being impacted as a result of climate. So there are many ways that the literature has influenced this. A colleague of mine, Anil Adishesh, wrote a position paper on this more than a decade ago, talking about the influences of climate change in workplaces. And he talked about all of the numbered items that I have here as a result, and looking at both of all of these and their influences on health. And I'll break these down a little bit further as I go along, but it's important to recognize that all of these will influence not only our physical health, but also our mental health. And as you may have heard in my introduction, I'm quite deliberate in using a biopsychosocial lens. Now, today I won't be talking too much about what that entails, but in my next seminar series, I will get into the details of that. But suffice to say is that the way I envision occupational health and safety and climate change is one through a biopsychosocial lens. What do I mean by that? I mean that I don't look at it just as the absence of disease. The traditional biomedical model looks at removing disease. If a patient comes to your care and if you can, for example, cure their ailment, then they're good to go. Rather, we have seen decades of evidence to substantiate that the biomedical model works in some instances, but in many instances it does fail, and it doesn't do a very good job of that. And in particular, in an occupational health and safety environment, we have to use the biopsychosocial model that have been endorsed by entities like the World Health Organization with different frameworks like the International Classification of Functioning, because they espouse to a much more holistic biopsychosocial lens, which looks at the individual, looks at their physiological characteristics, but also looks at the environment they're in, looks at their functioning, their abilities, their personal supports, and looks at this much more holistically. Obviously, it's a much more complex system, but that complex system is required to better understand the influences of climate change on the workplace as well. Similarly, because climate change is intimately tied to emergency services, we have to, and healthcare, we have to better understand how these are influencing not only the physical health of individuals in work settings, and I'll get into that later in my talk, but also how this is looking at their mental health, and in particular in industrialized nations, this is becoming far more pronounced, and even in lower and middle income countries, and I'll give some examples of that where this is also very much the case. Water supply issues, the financial sector, outdoor work, agricultural sector, you can see that the impacts of climate change on occupational health and safety are quite broad. And I invite you, as you look at this list, to ponder about using that biopsychosocial lens to query as to how these impacts could be reverberated in those sectors. So what I mean by that is that you may think of the very immediate, someone might get sick and be off work for amount of time, but think about the long-term implications of, for example, somebody who may experience a hurricane or a natural disaster, and this pretty much wipes out their entire livelihood, and what impacts it will have not only on their physical health, but their mental health as well. If they have nothing there afterwards for them to support their livelihood and their living, this is going to have consequences well beyond just their physical health, and that's significant. And I think as anybody who is interested in occupational health and safety would recognize that the importance is to look at all of this in its totality. Again, I also wanted to kind of bring this figure in from the same article, and I have all my references included in my slides that will be available to you, where we essentially provide a conceptual model that's, again, from the literature, where climate change influences both directly and indirectly different facets in the environment. For example, if you look at the floods, storms, etc., those are direct influences, while the indirect ones may be as a result of increased pollution and so forth, and the impacts it has on the workplace. And those impacts are going to be the ones that I'm going to explore further. Now, before I kind of continue, I also want to orient you that the biopsychosocial approach in my discipline of occupational therapy looks at certain parameters. So if we're looking at climate change and looking at occupational health and safety, we have to be able to orient ourselves as to how we can provide interventions or approaches that are evidence-based. And this model, called the person, environment, occupation, comes out of occupational therapy more than 30 years ago, or approximately 30 years ago now, where it looks at opportunities to intervene both at the individual level, at the environmental level, and also in the occupation level. Or what I'm saying here is that activities that they're engaging in. But in our case, we're obviously looking at paid activities. And the confluence where these three spheres come together is what we term occupational performance and participation. What I mean by that is where you're going to maximize functioning and you're going to maximize essentially work performance. So if you can mitigate against what we call occupational performance issues in these three spheres, you're going to augment that work performance. And that becomes quite significant as we talk about the physical and mental health examples, because this framework, in addition to looking at it through a biopsychosocial lens, will provide you with a very holistic and comprehensive approach that will not only work in looking at examples through a tertiary lens or a reactionary lens, but also through a preventative lens. And that becomes significant because not only do we want to respond after something has occurred, but how do we mitigate it from occurring in the same place? So it has significant implications as we go further along. In addition to that, I also want to recognize that what I'm going to be talking about in terms of occupational health and safety is going to be influenced by my biases and my perspective of the world. Naturally, I'm in a high income country. I'm studying these phenomena in a high income setting. So as a result, a lot of my examples are going to come from that type of context, but is not to say that we don't observe this in different parts of the world. And some of the examples, particularly on the mental health side, will talk about how lower and middle income countries are particularly sensitive to this, far more so, maybe to no surprise here to anybody in the room, to the impacts of climate change on occupation and occupational health and safety. And some of the points that I have here recognize the fact that if we're going to provide interventions and opportunities for us to work collaboratively, we need to recognize that this is a multidisciplinary approach. For us that are coming from the occupational health and safety sphere, this is nothing new to us because we're used to working in multidisciplinary teams, but perhaps certain settings and certain disciplines may not necessarily do that. And to me, I think it's important to recognize the value of bringing in different perspectives. I bring in one perspective, one that tends to typically lean on the health side through a holistic lens, but there may be others that are also warranted in identifying risk prevention or mitigating against these types of climate change from a very different perspective. So I recognize my limitations, but also value that looking at it through a health perspective is going to provide a much more broader understanding of how climate change influences health and safety at work. So I want to tell you a little bit about occupational therapy because perhaps the audience may be wondering what it is that I'm exactly referring to. So according to the Canadian Association of Occupational Therapists, and that's the national body that represents the discipline, it's essentially a type of healthcare that is used to solve people's ability. And in the occupational health and safety context, oftentimes occupational therapists demonstrate leadership in studying the work requirements, or what we may call job demands of an individual work setting. We will evaluate both the physical demands, the cognitive demands, and then come up with a much better understanding of what requirements are needed to do a certain type of job. In addition to that, we're highly trained to be able to evaluate and provide opportunities for someone to return to work in a meaningful way, in a way that recognizes their individuality, but at the same time takes into consideration the jobs that they have to do, the individuals they have to interact with, and looks at that in a very holistic manner. Again, you're seeing that I'm constantly going back to this biopsychosocial approach, but it also gives us that opportunity to hone in on why it's so important, particularly when we're looking at climate change and occupational health and safety. Similarly, just to give you a little bit more on the discipline itself, we oftentimes support relearning different activities, fine and gross motor movements from a physical side. For example, in pediatrics, occupational therapists will work with children in improving their writing or their pediatric ergonomic settings in the classroom. With older adults, oftentimes you'll see them in acute care settings in hospitals or in community care, supporting someone's functional activities after a stroke, for example, or a cerebral vascular accident or a heart attack. And it may involve getting them to be able to regain functioning with self-care activities or with productivity or leisure activities. A lot of this is part of our domain. We're also very much influenced in the mental health setting, and we provide interventions from a assessment to treatment and different types of modalities to support someone's mental health and well-being. I thought that was important to present because this influences how I work in the area of occupational health and safety, and also how I view the influences of climate change on this type of environment. So in addition, we oftentimes will work with individuals that may have illness or are hurt at work. We will communicate with their employer, with the worker, with their colleagues, keep the lines of communication open. We also help with that transition and readiness. So it's very important that we have these types of considerations as we kind of proceed forward together, because when it comes to the influences of climate change, I think that occupational therapy and occupational science has a lot to offer in both the intervention side, but also on the prevention side as well. So what are some of the impacts of climate change on physical health, in particular in the occupational health and safety context? There is a growing body of literature looking at the impacts of climate change on cardiovascular health, of looking at chronic conditions like kidney disease. And in addition to that, working in environments where there is elevated levels of heat as a result of increasing temperatures. We're seeing the body increasing. There might be hyperparaxia as a result of that, or basically having an elevated fever. All of these are examples of how you could potentially see someone be experiencing things like heat stroke, heat exhaustion, fatigue, being more or less responsive to different types of medical interventions or medications. So all of this is influencing how someone's physical health as a result of climate change. And maybe these links aren't being intuitively discussed in the daily vernacular that we all interact with newspapers and the media and so forth, but they're definitely there. And I will say that there's a lot more work to be done, particularly from the health side. Similarly, different sectors are also sensitive to this. The skilled trades, the construction sector here in Ontario, Canada, we have a significant shortage of these skilled labor and this expertise. And as a result of seeing the issues with cardiovascular deaths, this is an area of concern. And climate change is only going to exacerbate things. Similarly, in the mining sector here in Ontario, and I'm sure in other jurisdictions, we're seeing an increase interest in rare metals and metals that are used, for example, for battery use in electric cars. And this is going to increase naturally the opportunity for people to be employed in these areas, but also to their relationship with climate change. And that has to be explored. Similarly, in other primary sectors as examples of this as well. So looking beyond that, I also want to look at it from a climate change perspective on the impacts on mental health. And the screenshot that I have here looks at mental health from a policy brief that the World Health Organization recently released, and the link is there. You can kind of look at it. And I'm just and really what they're kind of getting at is that you have to include mental health as into the considerations of an individual's health and well-being. So before I kind of go into this slide, I kind of want to say a couple things. One is that the mental health aspects and considerations are probably not as easily identifiable. They may not be as overt as the physical health ones. You know, if you're experiencing high levels of heat in that environment and you start to sweat and you have heat exposure and you become tired, that's more visibly apparent. But on the mental health side, those can be a little bit more subtle to detect, and they may be as a result of why we need more attention into this area. There obviously also are, for the most part, have very long-lasting implications on people's health and well-being. And this is quite significant because as we look at natural disasters, we look at the impacts of different types of pathogens, we're seeing the reverberations of these mental health consequences in our daily lives all the time. So I'll give you some examples here in in Canada that I think apply globally now. So in terms of the healthcare supply, we don't have to go very far to understand that this pandemic has placed a significant burden on our health system. And our health system is made up of human beings like you and I that are providing essential care from various disciplines. And some of the ones that have received a lot of attention, for example, physicians and nurses, but there are many other practitioners as well. And they've, as a result of this pandemic, have experienced significant levels of burnout. They've experienced significant levels of job stress. And all of this is part of the totality of understanding it through a biopsychosocial lens and understanding that these mental health consequences will have very long-lasting implications. In a resource-rich country like Canada, we're privileged in the sense that many of these individuals will have access to care. But if you look at lower middle income countries where we have so many people in need of mental health services, they do not even have access to that care. And that becomes even further significant when you look at the occupational health and safety context and the fact that if somebody, for example, is working in a setting in a lower middle income country and a natural disaster occurs and that factory is destroyed, what happens to that individual? What kinds of supports are available to them? And these are significant issues that we have to start pondering. And similarly for the healthcare system in those environments, they're going to be already stressed and it's going to make things worse. One of the particular topics that you may have heard about, and it's very much in the media here in Canada, and I think in the Western world, is this idea of occupational burnout, and it being really a condition where somebody is exposed or is experiencing emotional exhaustion, depersonalization or cynicism, not feeling that they can make a difference in their environment, and really having this diminished personal and professional efficacy of making a difference in the environment they're working in. Many times, in particular in healthcare settings, healthcare providers are there to support and to be a helping profession. They want to ameliorate someone's health and well-being. But if they're experiencing burnout, it creates a significant issue. And if you can imagine from a occupational health and safety issue and a climate change issue, this is becoming one of the most pressing issues globally. And I'll give you some examples of why that is. A little bit about burnout. I think I've covered this point, but it is an occupational phenomenon. The International Classification of Diseases labels it as that. That's basically a resource that's used for identifying diseases and for diagnosis purposes. So ICD-11 has that definition of burnout. Similarly, burnout is impacting a great deal of the health population. In the United States, less than a year ago, the Surgeon General came out and said that burnout is his top priority in the healthcare system. So you can think about the reverberations of this pandemic and how it's impacting the health system globally, and how this is now impacting the people that work in that system. And I can tell you as a clinician that it's extremely difficult to find the health human resources we need to support our health settings today. And I think if you can see the link and the relationship between the two, it's quite significant. So they generated this report in the United States, the Surgeon General, and looking at how burnout influences healthcare providers. And they kind of looked at it again through a very holistic lens, both at the individual level, so the workplace and learning environment, and they went all the way up to the societal context. The report is available for free of charge. You can just type it into your search engine and it'll be available, and it's also in my references. But enough to say is that this is not a personal responsibility of the individual alone. This belongs both at the organizational level, it belongs at the system of health systems, in the sense that how are these health parameters funded, these health systems funded? How do we prioritize different funding needs when we have finite resources, and add to that complexity when climate change influences are put on top of that? What types of decisions are made? How do we ensure that our health responses, our healthcare system, are responsive to that, particularly from an occupational health and safety setting? and also from the perspective of the societal and global cultures. These are essentially values that different societies put on supporting their health systems. I won't go too much into this, but the impacts on supporting the healthcare system from an occupational health and safety setting is going to be far beyond just the individuals that are working in that setting. Ultimately, it's going to impact the types of patient care that you and I receive when we interact with the healthcare system. And as a result of that, this is a top priority for not only the United States, Canada, but also the WHO. In fact, I can tell you that the WHO released a very comprehensive report on mental health in the workplace in September of 2022, where they discussed the challenges of substantiating occupational health and safety from a mental health perspective. And I think the value here is that we have to look at it through also the climate change lens as well, because that's, I think, something that's significantly understudied and undervalued in today's healthcare system. I also would be, I'd like to also recognize that our team and our lab has looked at occupational health and safety from the consideration of both not only certain healthcare providers that are in the limelight, but those that you may not hear about. And we've done some work with medical laboratory professionals here in the province of Ontario in Canada. We've looked at their health, their well-being, burnout, and other types of under-recognized health populations. And we've consistently found similar types of issues with burnout, lack of recognition, decreased job security, and all these pull factors that are taking people out of already a strained system. And this is going to be further exacerbated, as I said, because of climate change. I think I'll come to the conclusions that I have for this talk with a couple of points for your consideration. One is that we have to increase our understanding of the effects of climate change on human health and work. This is unfortunately not an area that is receiving as much attention, both from researchers and scholars, and also from governments and policymakers. I think that we need to recognize that climate change will continue to influence how we work, how we live. And as a result of that, we have to better understand mechanisms, relationships, not only through a quantitative perspective, but also through the perspective of the individuals that experience them. So what we quote unquote call the lived experience. And I think all of that matters because examples that we look at globally, it is through the individual's experiences of having dealt with a natural disaster and the implications it has for them for decades onward, in some cases where they're not able to return to their livelihood, their work and health and well-being will be compromised. Similarly, I think a lot of the funding that's gone into supporting occupational health and safety has not necessarily looked at it also from the mental health perspective globally. And I think we need to increase our recognition of mental health as being part of the overall health. There is no health without mental health, as maybe you've heard that saying. So I think that there needs to be greater recognition and emphasis and resources allocated to supporting health and safety at work, with focuses on physical and mental health. There's still very, very small slices of budget lines from governments, and they're not receiving the attention given the totality and the implications that we're observing firsthand with the example that I provided in the healthcare system. And there are many other examples as well. Similarly, I also want to challenge all of us as academics, researchers, as learners, as policymakers, to recognize that we need to incorporate climate change into our educational curricula. So what I mean by that is that, you know, I'm sitting here with you from the University of Toronto in Toronto, Ontario, Canada, and we don't have enough of that material around the impacts of climate change on human health, functioning, well-being, let alone occupational health and safety. And I am continuing to champion that we include this into the work that we're doing and ensure that this is recognized not only just from a researcher's perspective, a clinical perspective, but the entire group and everybody that's working in this area. I'd be remiss if I didn't end my talk by recognizing that I am one member of our research team. I get the privilege and the honor to sit here and talk to you about this very important topic that's near and dear to my heart, but I think many members of my research team. I've kind of put this photo of all of us together. This is definitely a team effort. We work together. We're passionate about the topics of occupational health and safety. We recognize that climate change is having a pronounced impact on how we engage in work activities. And this is only going to be further influenced as we go into the 20s and the decades that come after that, as we see the impacts of climate change unfold. Similarly, I also want to recognize that to us at the Restore Lab, we use an equity, diversity, inclusion, and accessibility lens. That means that we recognize our individual diversity, we recognize our individual strengths, and that we leverage those to ensure that the opportunities that we have in front of us are those that directly aligned with the strengths of our team members. So you will soon hear in a few weeks from our colleague, Dr. Vijay Chatu, who will be talking about the global aspects of it from a health diplomacy perspective and how that is influencing occupational health and safety, as well as the implications that climate change have on it. Just to give you an example. But if you want to learn more about our lab, I invite you to take a look at our website to see what it is what we're doing. We're very open to collaborations, to learn from you, to see how our expertise and our skill sets may be aligned with answering some of your questions. I think I'll stop there and maybe see how we can discuss this further if there's any questions or comments.
Dr. Nowrouzi-Kia, thank you so much. That was just absolutely full of really interesting insights and ideas and challenges, I think, for us as we navigate the Anthropocene and the many challenges ahead. I also, all the way through your talk, was struck by this theme of cascading and compounding influences, right? That climate change doesn't happen in a vacuum. It happens around the same or in the same context as economic stressors and social stressors and political stressors, that the individual manifestations of climate change aren't isolated. Someone who's dealing with heat exposure might also be dealing with wildfire smoke or with zoonotic spillover of disease and so yeah, your whole talk really inspired me to think about these cascading and compounding dimensions of the impact on occupational health. I wanted to start the conversation, though, by picking up on a theme you highlighted at the end, which was the diversity of your lab. And I was wondering if we could talk about the diversity and heterogeneity in the context of both the benefits and harms of work. Early on in your talk, you highlighted the way that work can play a beneficial role. But I think in many cases, these benefits and the costs aren't equally distributed. Right? A factory job is not the same as a job where you now have the luxury of working from home, right? This isn't equal or spread equitably across different geographies and across different socioeconomic status. And so I'm wondering if you can tell us about how the field is accounting for the fact that the benefits of work and the harms of work are not always equally shared across different populations.
Absolutely. And thank you for that consideration. I mean, I wish I had more time. I could talk about this all day with you, but to address your point, you're absolutely right. The inequities that we're experiencing, particularly if we use the pandemic as being the latest example, and one that probably has impacted, has had so many influences around the world, it has impacted different groups differently naturally. The data that's come out there, including our own labs data, is that, for example, women have been impacted their health and well-being more than men have, traditionally because they've also shouldered more of the family responsibilities and they're more likely to go off work and not return to work. Similarly, those that may identify as vulnerable communities, marginalized individuals, visible minorities have all been impacted further, more so than those that have perhaps have more privilege and can work remotely and sit and not necessarily be exposed. Some examples of that are, if we think of the the pandemic earlier on here in Canada, we had people that were working in grocery stores and hourly wage workers, and how they had to go to work because they were exposed to COVID-19, and they were exposed to the coronavirus as a result of that, while others had the privilege of going in, doing their shopping, and then going back and working remotely. So I think if you look at occupational health and safety, and you look at climate change, and if you want to use an intersectional framework, that is a great way to look at this. There are different intersections that people will experience, and all of us have intersections, whether it's gender, race, identity, and so forth, that we can explore. And I think all of these may compound on one another, and we really don't know very much about it. We have to further explore it. Our group is very interested in kind of looking at these topics. Some of our projects are related to looking at that intersectionality of, for example, looking at visible minority groups and their interactions at work and their experiences of burnout, but it's largely an unexplored area. And if you add climate change to this discussion, I venture that there are very few evidence or research-based studies that are supporting or giving us insight into this.
Thanks so much for that. I mean, speaking of particular populations, we had a great question in the Q&A down below, wondering if there's data about the effect of climate change on things like pregnancy and birth outcomes. And maybe we can expand that too to think about the intersections between maternal care, pregnancy, and the workplace as well.
Yeah, no, I think that's a great question. I don't know specifically. Thank you for your question. I don't know specifically about that data, so I don't want to speak about something that I don't have information on. But I can certainly tell you that based on what I just discussed about that intersectional perspective, most likely you're going to see added vulnerabilities for pregnant workers as opposed to someone who is not pregnant. So that is something that I'm fairly confident in, but I would venture that there's probably limited research in that area.
In your earlier example, you talked about the differential exposure that folks working in grocery stores and meat processing plants and factories had very high degrees of exposure to, say, COVID. And we saw this in a lot of our COVID research. We even had respondents who were talking about a sort of sense of dread that this fostered, right? That I'm going to get COVID because my employer doesn't care about me. They're not taking measures to protect me. I'm being exposed unfairly. This kind of dread and anxiety and frustration that sounded really deep-seated for many of our respondents. I'm wondering about how, whether we're talking about climate anxiety or dread attached to COVID or rising sea levels or other threats, how does that affect your resilience and your coping capacity in the workplace? And what's the sort of cutting edge in terms of research in how we can improve this, right? For a generation dealing with lots of climate anxiety, with an ongoing pandemic that's killing people daily, how do we address some of that underlying dread and burden and the way that influences aspects of our life like work?
Yeah, absolutely. I mean, that's a great question. I can tell you that, our research also found the similar types of things where people are anxious, they're depressed, they're burnt out, they're tired as a result of this. And the way to mitigate against that is essentially quite simply to increase access to care. And we've got a significant problem on two fronts. One is that in resource-rich countries like the one I'm sitting in, the issue is that we need that human resource capacity. We need individuals that have that training, and we have to look at our models of training and providing those services and seeing how we can maximize our efforts to address the need. In middle and income and lower and middle income countries, the challenge is further pronounced because you're dealing with the intersectionalities of lack of access, not having the health human resources, and issues particularly around the mental health aspect, around stigma, and the fact that people aren't seeking out those. So if you compound all of this in addition to the climate change issue, in addition to everything else, you've got the perfect storm as to why there's a tremendous amount of unmet need when it comes to health services. And if you look at it at work, similar, the example will hold true for that as well.
On that note, there's a great question from Sonia Sanita in the chat, wondering about the measurement of these things. So For instance, how you measure mental health in relation to climate change. Do you have any ideas or examples about the best practices for measuring that and where we need to go in terms of improving measures?
Absolutely. And, thank you for the question. I think that's a great question to be thinking about. I mean, there's lots of ways, there are tools available. And, in my second talk, I get into more of those types of tools, but I'll give you a bit of a prelude. There are guidelines and standards that are available that can be implemented into workplaces to support mental health and well-being, to create what's known as psychological safety at work, to support individuals so that when they go to work, they have a sense of purpose, they have a sense of identity, they're comfortable with disclosing. And that is not just a responsibility of the individual. This is deliberately a shared relationship where the employer or those in management have to demonstrate it through example as well. So there are tools, there are measures to do that quantitatively, but I think we have to go a little bit beyond that and look at it through that biopsychosocial lens, which is that we recognize the individual lived experience too. And this is particularly important in lower and middle income countries where the voices of the individuals may not be necessarily included. Sure, we can use measures for stress, for burnout, like Maslach burnout inventory, the Copenhagen burnout scale, etc. There's tons of these. But I think what would be particularly important is to marry those quantitative assessment measures with listening the lived experience of the individuals that experience, for example, climate change impacting their livelihood on a farm, or their impact of a hurricane or a natural disaster on their well-being at work. So a lot of this has to be bringing all of these ideas together and using that biopsychosocial lens. It's more complicated, it's more messy, but at the end of the day, if we want to get a broader, greater understanding and a richer understanding, this is the path that we have to take.
Thanks so much. One of the things that I've been quite intrigued by lately has been the need to shift away from focusing exclusively on acute events and looking at chronic exposures. So I'm a forest fire guy, and the example we're thinking about more and more in fire management is low levels of smoke exposure. It's not actually the really dense smoke at the scene of a wildfire that's causing most of the health harms. It's the little bit of smoke in New York or in Toronto that is causing really adverse effects for a large population. Another example of this might be in heat emergencies, that workers, yes, the peak temperature of the day is really critical, but prolonged or chronic exposure to heat or the inability to cool overnight can be really challenging. And we're also seeing this in climate-induced spillovers of diseases, right? We've seen a lot of research in the past couple of years about how viruses that we often thought of as benign, like Epstein-Barr, which causes mono, might actually have links to things like MS and long-term impact. And so the chronic exposure to common colds and common viruses has a detrimental effect. I'm curious where the research is at when it comes to these chronic low-level invisible exposures and what your thinking is about how we can improve those and how we need to address those.
Yeah, I think that's a great question as well. The research on that is that we need more of it. To look at these, we need longitudinal, long-term studies that follow individuals, quite frankly, from epidemiological studies that are looking at ideas of low-level exposure, whether it's a particular occupational hazard that they're experiencing, or from the mental health side as a result of a particular event, and what are the long-term impacts on their human health. We know very little, unfortunately, about it. This is something that we have to be exploring, but again, it challenges us because a lot of these topics are viewed in silos, as you said earlier. Like my colleagues in my department and those in health and safety are very interested, but to get the funders and the supports around this is a challenge that we're experiencing, and we have to get people to recognize that as well.
Great. Okay, unfortunately, we're running out of time here, but there are two more awesome questions in the Q&A from our participants that I would love to get to. So we'll ask those and then we'll wrap up.
Okay.
I want to start with the one from Nezrat, who raises a really, I think, great point about the many different causes of burnout. So Nezrat points out that causes like workload and short staffing are really significant drivers of burnout. And given their primacy, how do we think about the effect of climate that might be lower down the list in their articulation? So maybe you can speak to both this question of prioritization and how those interconnect too.
Yeah, great question. And thank you for the question, Nazrat. I think you're spot on. I mean, some of these factors like workload and short staffing have been identified way before the latest pandemic, or for decades have been known. So I think they're part of the influences, but they're certainly not isolated. And I think to your point around how do we look at the impact of climate change, and is it being put on the back burner? I think to an extent it is. The people that are making decisions about resource allocation, particularly in health human resources, aren't necessarily looking at the impacts of climate change when they're making these types of decisions. And we have to kind of, the education piece and the research has to substantiate that, and we have to include it in our discussions. We're way behind on this in the occupational health and safety world. We need more of these discussions, and we need them to include all the parameters. That's why I think like an intersectional framework, or this idea of looking at it through these multiple crossroads, is the way that we're going to be able to address this, not only from a reactionary perspective, but also from a prevention side.
Yeah, that's great. And Nezrat, thank you for bringing attention to that, because I think sometimes too, we have to remember the raw politics and funding and resourcing of these questions, right? That those are very important issues to tackle. Okay, let's end with Mudita's question, which I think will leave us on a good note here. Mudita's asking about how you hope to bring change in people's attitudes or in policy after you collect the evidence in your research. Do you make suggestions to policymakers? How do you try to translate your research into practice?
Yes, thank you, Adita, for that question. And I agree, we do all of that. Our knowledge exchange, translation activities are going to have to be better from as a researcher's perspective, right? So we write our papers that we send for peer review, or our reports, but we're trying to deliberately influence policymakers. We want to be at the forefront of their discussions and make sure that they have the available evidence as to make their when they make their decisions. But at the same time, recognizing that we bring in one voice to the table, but we need our partners. This is why I'm being very deliberate in being inclusive. A multidisciplinary, a transdisciplinary, an interdisciplinary approach is the way to address this. And we can no longer wait or work in silos, because it's going to be the detriment of ourselves today and also future generations moving forward. And might sound like a cliche, but it really is the reality.
Dr. Nowrouzi-Kia, thank you so much for your generosity of wisdom and insight in this presentation, and for your thoughtful answers to these questions. I wish we had more time to continue this, but unfortunately we're out of time for today. For everyone else, I would encourage you to join us for the next 5 of the sessions in this series. I think they'll continue to play out some of the themes that we heard about today, right? The cascading and intersecting dimensions of climate and other stressors, the need for a multidisciplinary approach, and the challenges of tracing out some of these subtle effects on occupational health and safety. So thank you so much for sharing your wisdom, and I'd encourage everyone to join us for the future conversations. Francesco, I'll pass it to you to wrap up and to share a few more details about how people can stay involved.
Perfect. Thank you so much. And thank you, Dr. Nowrouzi-Kia, for that great presentation. And thank you, Dr. Kennedy, for moderating the discussion and the Q&A. And thank you as well to everyone who took the time to attend the session live. If you would like to re-watch the session, the recording will be up on the event page and on our YouTube channel, which is CIFAL York, in a couple of hours. And for anyone who couldn't make it to the session, please feel free to share it within your network. And I will just quickly share my screen to show the next session, which will be in 2 weeks from now, on Wednesday, April 26th, at the same time as today, so 12 p.m. Eastern time. And the speaker for that session will be Dr. Vijay Kumar Chatu, who will be speaking on global health governance for climate-induced global occupational health challenges. And for anyone who would like to if you know, sorry, if you know anyone in your network who would like to attend or might be interested in these sessions, you can share the website with them. Registration is still open. And yeah, we look forward to seeing everybody there in 2 weeks. So I will just end the recording here.